Gallstones and kidney stones are often easily confused. They're both stones, but they're entirely two different conditions that are formed in two separate locations in the body. The gallbladder for the gallstones and the kidney, of course, for the kidney stones. And their causes, symptoms, and treatment are also distinct, but one thing they have in common is that they can cause pain and require medical attention. Get to know their similarities and differences, how to prevent them, and what treatment options are best for you. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk on CNN Philippines. We're here to build a healthier future for you. Kidney stones and gallstones may start off as just a few millimeters in size, but yet they can cause a patient so much pain. Our guests are here today to tell us more about this. With us is Dr. Ulysses Quanico. He's a urologist from the Urology Center of the Philippines Incorporated. And also with us is Dr. Ira Inductivo Yu. She's a gastroenterologist and the president of the Philippine Society of Gastroenterology. Thank you both for joining us here on the program. Let's start first with kidney stones. Now, kidney stones may start off as very small and may pass even unnoticed through the urinary tract, but some can grow very big. Now, they're made up of mineral salts that form inside the kidneys. Now, Dr. Yul, let's begin first explaining kung paano ba nangyayari ang mga kidney stones. How do they form?
I'd like to say that there are the soft stones, which is called the matrix, and there are crystalloids, which are formed by your uric acid, your calcium phosphate, or your ammonium phosphate, and these are the more common ones. Actually, the stone forms by having a lot of concentration of these crystals in the urine.
Anyone, any person can or has the capability of forming kidney stones, both adults and children ba, doctor?
It's more common in the grown-ups, like 40-year-olds or older, but children can have, especially if they have metabolic issues regarding the excretion of calcium or excretion of uric acid and infection as well.
It's good that you mentioned that this mostly happens to those who are 40 years old and above. Ano? Mas common ito sa age group na yon. Let's talk about what other factors contribute to someone being a stone former.
If you have some problems with your uric acid, for example, you would easily form a lot of concentration of this uric acid in the urine. And if you have also problems with your calcium intake or phosphate intake, you will have calcium phosphate in your urine.
Now, as Dr. Yul mentioned, there are 4 different types of kidney stones, mainly your calcium, your uric acid, struvite, and even your cystine stone. Now, the calcium stone is the most common here. Dr. Ira, importante ba malaman ng ating mga viewers kung anong klaseng stone pwedeng mangyari sa kanila? Or mas importante bang malaman nila kung ano ang pwedeng mangyari kapag meron silang stone?
Both issues are equally important. Number one, it is important they should know what type of kidney stones have formed so that the precautionary measures can also be modified to prevent that kidney stone. For example, if your patient developed uric acid stone, then that patient definitely should avoid purine-rich diet like atay, mani, cashew nuts, shellfish. If, on the other hand, that patient developed calcium oxalate stones, then they should be avoiding too much of calcium supplements.
Uric acid stone is actually more common in men than in women, and it happens madalas when a person loses too much fluid in their system or is often dehydrated. Now, Dr. Ira, I think that's an important thing to mention as well. Why are certain stones more common with women or with men than the opposite sex?
Primarily because of hormones and also by occupation. Okay, as you've mentioned, uric acid stones are usually seen when there is some degree of dehydration. So baka nakikita natin to sa mga drivers natin who tend to hold their urine because they are in the middle of the road. So that would also predispose them to stone formation, primarily uric acid stones. Okay, patients who are also binge drinking, usually they consume lots of cashew and nuts as pollutant.
Now, yung struvite stone, on the other hand, ito ay mostly nakikita sa mga babae. Dr. Yul, itong klaseng stone, itong struvite stone, paano ba nangyayari ito?
Struvite stones are infection stones. They usually are induced by bacteria that what we call the urea splitting bacteria. These are organisms that can cause stone formation. And as you know, it's more common for women to have infection, urinary tract infection compared to men. Dahil mas maiksi ang urethra ng babae compared to lalaki. So they're really prone to infection. And these are the type of infection stones that you can get with in women.
There are some studies that show that consuming vitamins as well as supplements in high doses actually lead to kidney stones. When is it too much to take these vitamins and supplements? Lalo na ngayon, we are loading up on certain vitamins like vitamin C, for instance, to help protect us from COVID-19. Dr. Ira, can you talk a little bit more about this? You actually touched on this a little bit earlier, but share with our viewers some of the risks of taking too much supplements.
For like vitamin C, the recommendation is really up to a maximum lang of 500 milligrams per day. There are no studies that if you consume 2,000 milligrams of that, you will be super powerful individual. Okay, so limited to 500 milligrams. So I think the dictum here is for us to just really go with what is the recommended daily allowance of these vitamins and supplements.
One of the most common types of kidney stones is made of calcium oxalate, which may lead you to avoid eating calcium, but the opposite is actually true. Low calcium diets may even increase your kidney stone risk. Calcium supplements, however, may increase your risk of developing stones. Now, this is something that I'd like to discuss with Dr. Yul. Please tell us how these factors may increase the risk of developing stones.
Calcium plays a role in the metabolism, especially in the exchanges of the ions in the kidneys. So if you have low calcium in your diet, that the chances that your body will try to compensate by absorbing less calcium as well will result in a more calcium in the urine. So that would lead to stone formation. So the deficient calcium in your diet will also have an effect on your formation of stones in the urine. So there has to be some balance. So you need at least 1 glass of milk a day.
What are some of the other symptoms na pwedeng maramdaman ng isang taong may kidney stone? Dr. Ira, could you please talk more about this as well?
Some patients also, because they are already suffering from the urinary tract infection, which is very common among patients with kidney stones, some may also have some degree of fever or chills or even body weakness. Okay, but again, the most common cause, the most common symptom is always pain. The pain may not necessarily just be at the back. It can be in the puson area where the bladder is. It could be at the sides where the ureters are. And the bigger the stones, the more intense are the pain.
Now, did you know that you can have a kidney stone so big for years and not even notice that they're there? How is this treated? We'll talk about this and more when we return. We're your connection to healthcare. Stay with us right here on CNN Philippines. Treatment for kidney stones will vary depending on the type of stone you have and its cause. And most small stones won't actually require that much invasive treatment. Now, I'd like to ask Dr. Ira, paano usually tinitreat ang mga maliliit na kidney stones? Stones that can pass readily out of someone's system. Is drinking water, just plain water, enough to help?
You have to drink plenty of water. You need to hydrate yourself. The recommendation is like 2 to 3 liters a day. But of course, you have to always talk to your doctors. Ha? Not all patients are allowed to drink that much. So sino tong mga to? Kidney patients who are on dialysis, they cannot overload with themselves with too much water. Patients who have marginal cardiac functions, those that are always in heart failure, they cannot just hydrate liberally. Okay, so these people, they cannot just be advised to drink too much water. But in general, if you don't have any of these comorbidities, yes, drink, hydrate, try to aim 2 to 3 liters a day.
More painful for men than it is for women. Dr. Yul, could you explain why this happened? Why the pain even happens in phases?
Even if there's no pain, as long as there is a stone noted in the kidney, we need to do some treatment. For example, our seafarers, they work abroad, they work in the sea vessels that are quite far from the land, so they have to be treated before they get some symptoms. And depending on the size of the stone, if the stone is just about 0.3 millimeter, for the seafarers, they can probably be given a pass. But if it's bigger than 0.3 millimeters, they have to be treated because it can potentially cause pain while they're working abroad or aboard a vessel. And that's going to be dangerous for them.
For those with kidney stones, so talk to your doctor with what is best for you. Now, like kidney stones, gallstones naman can also be very small or even as big as golf balls. Now, some people develop just one gallstone while others develop more than one at the same time. Dr. Ira, let's talk about the gallbladder. What is its function? What does it do for us?
In the abdomen, it sits on the right upper part of the abdomen. It sits just below the liver. Okay, as far as function is concerned, okay, this small organ functions primarily to store bile. But if it is not yet used by the body for food digestion, particularly for fat digestion, then that bile gets stored and gets concentrated in the gallbladder.
Dr. Ira, pag-usapan naman natin, how does a stone form inside the gallbladder? At dito sa Pilipinas, sa mga Filipinos, which is the most common type of stone na nagfo-form?
Gallbladder stones are caused either your bile is too much saturated with cholesterol or too much saturated with bilirubin. In general, there are different types of gallbladder stones. We have the pure cholesterol stones, we have the pigment stones, and we have the mixed stones.
But a lot of our viewers always ask, merong connection ba itong mga gallstones sa kinakain? So let's talk about that. Ano ba yung mga kinakain nating mga Filipinos that make us prone to having gallstones?
Filipino diet natin, mahilig tayo sa sisig, sa mga baboy, at sa mga fats. So I think it can precipitate the formation of gallstones.
Let's talk about ano ba yung nararamdaman ng isang taong nag-uumpisa pa lang ang simptomas ng gallbladder stones. And let's go further with what happens kapag hindi ito agad napatignan.
Majority of those with gallbladder stones will not have any symptoms. A lot of them will go to your clinic, present their ultrasound because they just want an executive checkup or they had an ultrasound for another reason, and coincidental finding lang po ang gallbladder stone.
Now, a lot of our viewers might think kung nakitang meron na akong gallbladder stones, they might think gusto nilang tanggalin. Why is it better to just leave them alone if they're not causing any symptoms?
When patients come to us with asymptomatic gallbladder stones, actually we already offer two options. Okay? One is just, wait for the natural course of the disease, okay, and then operate only when there is need, only when there is cholecystitis. We call that actually emergency.
Dr. Yul, could you explain some of the advantages of having laparoscopic surgery to remove someone's gallbladder?
Laparoscopic surgery for gallbladder is revolutionary now because you only have a few puncture sites in the abdomen. They inflate the abdomen with the carbon dioxide so that they can get the scope in and work with the instruments. So no hands will get inside the body, but only the instruments will, and take the gallbladder out.
Now, following a healthy lifestyle can reduce your risks for developing these stones. More on these when we come back. You're watching Med Talk Health Talk, where your health is our mission. There's a lot to be gained from living healthy. Diseases and other medical problems can be avoided, including both kidney stones and gallstones. Avoid habits that increase your risk for developing these types of stones. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines, where your care comes first. The best way to avoid kidney stones is to make sure you drink lots of clean water throughout the day. Dr. Yul, aside from this, how else our viewers prevent kidney stone formation?
If you have a history of kidney stones, you have to identify what type of stones you had, so that your doctor can give you specific precautions for the prevention of the recurrence. But if you want to prevent, for those who don't have stones yet, I think a healthy lifestyle will really help prevent the formation of stones. You need to do some exercise so that whatever crystals there are in your kidney can be excreted out right away.
Dr. Ira, once the gallbladder is removed, paano na ngayon yung diet nila? What should they be mindful of? And siyempre, importante ang bile in order to digest fatty foods. Where or how can fatty foods now be digested?
What happens is if you still indulge in a lot of these oily fatty foods, the liver would still produce more bile to digest. So this bile, because there is no more storage, will go directly to the intestines for food digestions. And too much of this bile in the intestines would still produce your crampy abdominal pain.
How about exercise? Will someone who has regular exercise makakapagpababa ba ang chances ng pag-produce ng gallstones?
Wala siyang direct study, no? But exercise impacts positively in terms of cholesterol formation, in terms of the total cardiovascular status of your patient.
We hope you found our discussion today helpful. Thank you very much, urologist Dr. Ulysses Cuanico and gastroenterologist Dr. Ira Inductivo Yu. Both gallstones and kidney stones happen for a number of reasons. In most people, kidney stones can be prevented, but for gallstones, prevention isn't guaranteed, although steps can be taken to lower your risk. Keeping yourself hydrated, eating a healthy diet, and getting regular exercise are some of the ways to prevent getting these stones. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez. This is Med Talk Health Talk on CNN Philippines.